I remember laying down on a gurney and my partner was on the other side, and I remember saying, this is not real, it's not happening to me. My name is Roderick Jones, and I'm the executive director here at Goddard Riverside Community Center. And we serve approximately 20,000 people every year. I happen to love the seniors in particular. I think when you get to hear their life story, you realize that there was a significant journey from where they started to there.
You want another drink? Some tea?
I was in the house, in the bathroom, and I was looking in the mirror, and I can't remember if I was combing my hair or just looking at a spot on my face, and then I could feel myself starting to sweat. And it just began to sweat more and more and more. And if you can imagine just profusely sweating, but you're not on a treadmill, you're not on a bicycle. Then I began to feel myself going down on my left side. And in fact, I didn't really realize I couldn't move my arm until I had to lean over and pull my arm onto the vanity. And I said, something is really wrong.
We did a CAT scan and we saw that he had a intracerebral hemorrhage. He's only 47, so it's not impossible to have it that early, but it's rare to have it that young. This is a devastating form of stroke in which patients are generally unable to take care of themselves after the stroke, so many end up in nursing homes.
Before we started doing these minimally invasive endoscopic procedures in the last few years, there was no option. And so it's pretty amazing that these patients have any option at this point. As the field has been working to figure out how do we do this the right way, we struggled. We believe with the SCUBA technique, we've come across that ideal approach, and it's gaining traction, and people are starting to pay attention, and they do that because the data speaks for itself, and the patient outcomes are really impressive.
I can't imagine them cutting my entire cranial open to get to the spot. And so after they got me in the hospital, they offered me the minimally invasive surgery.
Really, it was only a matter of hours between him getting to the hospital. We got the scans and got him to the angio suite, and then we were able to remove the hematoma. So the way the procedure works is you make an incision on the head. With computer guidance, you pass a sheath into the hematoma, and you remove the center part and then put in the camera, which is called an endoscope. And then you put the sucking device down the endoscope, and then you can suck out the blood clot. The step that we started doing is we started continuously irrigating to wash out the cavity, and also to inflate the cavity enough that we can look around and we can see if there are any bleeding vessels inside the cavity. And we have been finding in about 50% of cases there are some arteries bleeding. And when there's an artery bleeding, you can put some cautery directly on that, and you can cauterize the vessel and stop the bleeding. So we think that that is a very important step because it decreases the chance of having bleeding after the procedure, where that was something that people were having a hard time with before introducing this irrigation step. People are having a hard time with bleeding happening in the 24 hours after the procedure. So you'll get a CAT scan on the day after and see that actually it might not look like you had done anything because the blood has recurred.
It becomes a very elegant, very technical procedure. And that is what's allowing us to affect about 90% evacuation of the clots consistently. And when we're able to get that great of an evacuation, the patients appear to make often some pretty dramatic improvements.
After the procedure, we removed the breathing tube, and with this kind of disease, you never really see people getting better immediately. But with his case, right when he was in the ICU afterwards, he was able to lift up his left leg, and that was really motivating.
I mean, everybody was excited. The resident was excited, the nurse was excited, everybody was excited. And so it was like, that was like a milestone moment.
It is only because of the fantastic teammates and partners we have here, from the nurses to the techs to my neurosurgical colleagues, that we were able to develop this brand new technique to save lives. I feel like we're changing the world. I feel like in 10 years, what we are doing here right now will be the way the rest of the world treats intracerebral hemorrhage.
Isn't he gorgeous? And just think he's the manager.
I progressed in a couple of days of walking again. I mean, it was fairly miraculous, the recovery. In fact, the first thing I did when I got out of the hospital is I walked the Brooklyn Bridge like that Saturday. I walked the entire Brooklyn Bridge, which is my favorite place in the entire world. I think that's the beauty of it, is not only you live, but you live with a quality of life.